ventilation-perfusion coupling, or the VQ ratio. V here stands for ventilation. Ventilation is the amount of air or gas that reaches the alveoli. It is controlled by bronchial dilation and bronchial constriction. Smooth muscles in the walls of the bronchi will either contract for bronchial constriction or relax, bringing about bronchial dilation. Normal ventilation in a young adult is about 4 liters per minute. Perfusion is the amount of blood flow in the pulmonary capillaries. Normal perfusion is equal to cardiac output, which is 5 liters per minute. Perfusion is controlled by vasoconstriction or vasodilation of the arterioles feeding the pulmonary capillaries. This ratio is an important ratio, and it's used to assess the efficiency and adequacy of the matching of the two variables, ventilation and perfusion. In this equation, V represents ventilation and Q represents perfusion. If you do the math and you take the 4 liters per minute for ventilation and divide it by the 5 liters per minute for perfusion, you get a VQ ratio of 0.8, a little bit lower than 1. It is important to maintain a VQ ratio that is normal. If there is a mismatch with the VQ ratio, this can lead to imbalances in your blood gas levels. It can lead to hypoxemia, low arterial oxygen levels. I'm going to show you some situations, and I'll want you to try to determine how you're going to maintain a VQ ratio that is normal. The first situation is if you have decreased oxygen in the alveoli. If decreased oxygen in the alveoli occurs, you will want to decrease perfusion to those alveoli. The way that you can decrease perfusion to the alveoli is through vasoconstriction of the arterioles feeding those pulmonary capillaries. An increase in carbon dioxide in the alveoli will bring about an increased ventilation. This will occur through bronchial dilation of the bronchioles. When you have an increased level of oxygen in the alveoli, you will want to increase perfusion in the alveoli to match the increased oxygen. This will allow that oxygen to diffuse into the blood. This increased perfusion to the alveoli will result from vasodilation of the arterioles feeding the pulmonary capillaries to those alveoli. Decreased carbon dioxide in the alveoli will bring about a decrease in ventilation. This is accomplished through bronchial constriction of the bronchioles.